So now we have the fantastic Dr. Keyur Patel, and this little concoction of tears is going to help us just get future scans in a more efficient way.
Okay, so like Brian was saying, the biggest issue we've had is that the software's got better, we're getting bigger scans. The issue we had was getting a good, consistent reflecting surface from the fluorescein, and we were getting bits and pieces of advice as we go along. And now we need to be more careful with COVID. So the idea of creating a big pot of solution and having it sit there for a day or so was not really ideal. So everything we're using should be available in pretty much every country. That's a fluorescein minim. That's a proximethicane minim. And for us, we've been using this 0.3 unit dose artificial tear. This particular one is by Avisor. So we get a tray or something that you can use to store it, and you take your first minim and you just empty it into there. All right, that's 1 minim of fluorescein. You then take your anaesthetic, the proximethicane, and squeeze that in. That's 1 minim of proximethicane. And then just to dilute it slightly, so you've got a little bit of, it's not too strong, just empty in the artificial tear. So we now know the exact quantities of each product, so we're getting repeatability with our scans. The cheeky thing, the slightly sneaky thing to do is you then take the empty minims. If you empty them out, you can just suck up your concoction, and that gives you probably about 7 or 8 drops in there. And you go the same with your second empty minim, like so. And what you then have is 2 pre-mixed
Sterile,
stable concentrations that you can use with your patients. And that really, you only need 1 per patient. So you'd probably get 2 patients if you do it in a clean atmosphere, clean area before actually dealing with your patient.
and that would be enough for most clinics in a given day, and worst case you open another couple of minims and then it's all ready and happy to go. Thank you, Dr. Patel, and thank you for the inspiration.